All right. Good afternoon again. This is Olivia Giordano from the Healthy Start TA and Support Center. Thank you for joining us for the Healthy Start Data Collection Forms Training Session 2. This training will provide an overview of the Healthy Start prenatal form. We're really excited to see such a great turnout for this webinar, and the numbers just keep rising. So that's really exciting. And we're looking forward to providing some content that we hope is really helpful for you. So first we'll just go through the agenda for today. We'll go over some brief housekeeping. Then I'll turn it over to Ken Harris from the TA and Support Center for a welcome. Then we'll hear from Benita Baker from the Division of Healthy Start and Perinatal Services for a greeting. Then we'll turn it over to Robin Harwood, also of the division, who will provide the overview of the prenatal form. Finally, we'll do a Q&A, and then we will have a closing from Ken. I'll turn it over now to Tess Pritchard, who will do some housekeeping.
Thanks, Olivia. Welcome, everyone. Today, we'll start our webinar with some housekeeping. This session is being recorded and will be posted to the EPIC Center for future viewing. All participants are muted upon entry. We ask that you remain muted to limit background noise. We encourage use of the chat box to ask questions and post comments throughout the webinar. All questions will be captured from the chat box, and we will address as many as we can during the webinar. We will create a Q&A document that captures all questions and answers that will be available with the webinar recording. Moving on to audio logistics. If you can hear me, you're likely connected correctly, but we'll do a quick review to ensure everyone's on the same page. Join the meeting by clicking the link in the email that was sent to you upon registering for this webinar. An audio conference box will appear. You can join by either computer audio or phone call. If you'd like to join by computer audio, just click computer audio and you should be all set. If you'd like to join by phone call, dial the given number, enter the given meeting ID and press pound, then your given participant ID and press pound. You will then be connected to the webinar audio. Next, we'll review the chat box. At the bottom of the Zoom screen, you will see a toolbar. Click chat and it will launch the chat box on the right side of your screen. Type your questions or comments into the chat box and send to everyone. Again, we encourage use of the chat box to ask questions and post comments throughout this webinar. Now that we've covered these housekeeping items, we are all set to begin. So I'll hand it over to Ken Harris, Director of the Supporting Healthy Start Performance Project team. Thanks, Ken.
All right, thanks a lot, Tess and Olivia, and good afternoon to everyone as well. I hope your day is going well. We appreciate you coming back for training number 2 on the data collection forms. And first off, I just want to thank you all for submitting your questions with regards to all of the forms. And so today's training, we tried to incorporate as many as we can in design of the training. But again, as Tess has mentioned, there will be a Q&A document available at the end of these trainings. So, and if you would like to, at this time, you might want to grab your prenatal form, and you certainly are welcome to have that along with you as you go throughout today's training. So we're happy to support the division in implementing this training today. And I would like at this time to introduce Benita Baker, who will give you a greeting on behalf of the division. Benita, I'll turn it to you.
Thanks, Ken. Can you hear me?
Yep.
Okay, great. Hello, everyone. I hope you are well. And thank you for attending the first training session last week and for joining us again this week for the second and third sessions. Lee Wilson, our acting division director, couldn't make it today, so he asked me to share greetings on his behalf. We know this is an incredible busy time and you have a lot on your plates, and so we appreciate you making room for these important trainings, which are intended to help you to report information accurately and in a timely manner. As you know, we need this data to tell the story of the program's success. Funding for the Healthy Start program also hinges on accurate data collection. And so it is critical that we get high quality, accurate, and timely data. Again, we hope these trainings will help in doing that, and we plan to provide any supports and resources you need to get this done, along with the Healthy Start TA Center. Please think about what else we can do to support you in this work and let Ken and his team know. We thank you in advance for your attention and commitment to data collection, and I know We have a lot to get to, so I'll turn it over to NICHQ. Thank you.
Okay. Thanks again, Benita. If we can go to the next slide. So again, you've heard the welcome on today's training, and what we would like to do again is remind you that we've tried to incorporate as many of your questions, answers to your questions that you submitted in today's presentation. So if a question is not answered, feel free to, ask it again. We have no problem with that. Our goal is to, again, have all those questions answered for you in a nice Q&A document of each of these forms. And so again, welcome to today's training. Next slide. What I would like to do is just to talk about how we're going to go through our training today, just to outline a little bit. We're going to review the last session. So there were several comments and questions that came up repeatedly. So we wanted to make sure we go over those with everyone. In addition to that, lots of questions around the timeline. So we'll show that again before we get started. And then we're happy to have Robin Harwood back with us to do our second training on the prenatal form. So again, if you'd like, you can grab your form and have it next to you as she's going through the training today. We also are delighted that the Boston Healthy Start Initiative and NICHQ have completed the second demo on the prenatal form. And so we actually will run through the form in detail through that video. And then we're going to have time for practice as we did last time. And then we'll come back and get into more Q&A. And we plan on addressing some of the frequently asked questions that you submitted to get us started with that in the afternoon, and then other questions that you may have. And we'll answer as many as we have time for. Next slide. So just to highlight a little bit, this is again the training on the 3 forms that we have. And again, I think it's great that we talk about moving from 5 screening tools before to now having 3 new forms, data collection forms. And so that was a tremendous feat in and of itself. And so we're happy that Robin's here doing our training, because she's been leading the development of these forms and working with the public comment, as she shared with you the last time. And so again, it's nice to have 3 forms to look at, and we know there's a lot there. And so we look forward to hearing more feedback from you even after you start using these forms. Next slide. So again, just with regards to the follow-up and Q&A document will be forthcoming, as I said. Go to the next slide. So just some answers that we wanted to highlight, again, that came up pretty frequently last time. But just to reiterate that you can start using the forms on May 15th is the actual official start date. And also we answered, you don't have to go back and try to do folks that signed up before then, but May 15th is the official start date. Also, with regards to the data collection forms and a crosswalk, they are available on the EPIC website now. The website is there for you. We had lots of questions around the Spanish versions, and absolutely, we've been working on that. And so those versions will be forthcoming as well. And then all trainings and recordings and slides are posted to the EPIC website. So last week's training is there on the website already, in addition to the video. So you'll have access to, again, the presentation and the video post webinar. So they're from last week, they're already up there for you. Next slide, please. And again, just to review the timeline, again, the first date to highlight was that May 15th date. And then also during the grantees meeting, we're planning to do a database demonstration on Careware. We just wanted to emphasize again, because the questions came, that Careware is not mandatory, but we just want to reiterate that Careware is a free option for all grantees should you select to use it, which would be aligned with the data collection forms, and we'll have case management capabilities as well. So again, it's not mandatory, but we're hoping that many of you would select to use it, as it is reflective of the data collection forms. Next slide. So with that, I want to introduce Robin again. We're happy to have her again, as I said. And please stay tuned for the entire webinar today. We also have an evaluation at the end, which are really helpful in designing the next training. So stay tuned throughout the entire webinar, and just welcome Robin. Robin, turn it over to you now. Thank you.
Thanks, Ken. Hi, everyone. I'd like to echo Ken in welcoming you to this second training session, this one focused on the prenatal form. As you might guess from its name, the prenatal form is for pregnant women who are enrolled as primary participants. Accompanying adults and custodial fathers do not complete it because the questions are specific to an enrolled woman's pregnancy. You'll want to complete each of the relevant forms, including this one, within 3 visits of enrollment or 3 visits of the transition to the prenatal phase for a woman who's already enrolled. Next slide, please. So today, similar to the other day, the first training, I'll provide a few general observations about the prenatal form and also its overall structure. Next slide, please. And here are the items I'd like to be sure to cover today regarding the prenatal form. With regard to the first item, we mentioned this last week, but it bears repeating to please continue to be alert to items that are in italics. These are read to the client versus items that are in brackets, which exist as staff records. And these staff records typically align with reporting requirements. Next slide, please. I'd like to say a few words now about the unique ID. The client's unique ID stays the same across all reproductive phases and over time. If a client is discharged from the program and returns at some point later, they retain the same unique ID. You'll also notice that although only pregnant women complete this form, the unique ID of any accompanying adult is also included here, and this allows the two to be linked in the database. And as you can see here, the unique ID has 3 parts. First, in green there, you'll see the org code, a 3-digit code that's specific to your site. And if you don't know your org code, the TA Center will help you identify it. Next, in red, you see the letters PP, and this stands for primary participant. So if a client were an accompanying adult, those letters would be AA, and for an enrolled child, it would be EC. And this just allows you to know which type of participant you're dealing with by way of the unique ID. And a third part of this is just for the client, the numbers client, beginning with 0001 and continuing upward sequentially. We want everyone to follow this format because there were a lot of complications that we ran into when creating the database with the huge range of IDs that were generated, and some were duplicated across sites, and it was very, very complicated. And so this allows us to identify the site right there and to identify the type of participant, and then just give them a number that increases sequentially. Okay, next slide, please. Finally, the post-pregnancy follow-up is a staff record at the end of the prenatal form, and it must be completed once a caseworker knows the outcome of a pregnancy. And this is a very critical piece of information for us. It allows us to track pregnancy outcomes. And Ken is going to have more to say about this later in this session. Next slide, please. And here is the overall structure of the prenatal form. The actual interview portion contains 13 questions, and there are 5 questions in the post-pregnancy follow-up, which of course you'll have to come and fill in later after the birth has happened or the pregnancy has ended. Okay, now I'll turn it over to Ken and Olivia. I think they have a demonstration ready for us.
Welcome to the second Healthy Start data collection form demonstration video. In this video, we will demonstrate how to administer the Healthy Start prenatal form. Morgan, a Healthy Start family coordinator, will administer the form to Maria, a Healthy Start mom. Maria has a 14-month-old daughter and is currently 4 months pregnant with her second child. Maria's boyfriend, Nick, often accompanies Maria to her prenatal visits and Healthy Start classes. Let's get started. The first step is to complete the grantee records section. This box contains information that is important for your Healthy Start site's records. Before beginning the interview, Morgan will fill in this box with the primary participant's name and date of birth. In this case, the primary participant is Maria. Morgan will also fill in the accompanying adult's name and date of birth. In this case, the accompanying adult is Maria's boyfriend, Nick. Finally, Morgan will fill in the interview's name. In this case, the interviewer is Morgan herself. Morgan will read the entire section, including the public burden statement, before moving on. This next section contains important information about who should complete the prenatal form. Remember, the prenatal form should be completed along with a new or updated background information form when a pregnant woman enrolls in Healthy Start or as soon as an enrolled woman finds out she is pregnant. This form contains a post-pregnancy follow-up section at the end. This section must be completed when the enrolled woman delivers or the pregnancy otherwise ends. You will need to provide a unique ID number for both the primary participant and the accompanying adult. This section asks for identifying information about the participant and their accompanying adult, if applicable. Morgan will read and fill out the entire general information section before beginning the interview with Maria. Morgan is now ready to begin conducting the interview with Maria. Remember, the forms must be administered by a trained Healthy Start staff member. It should not be self-administered or administered by untrained staff. It is important that you read all of the text in italics as it is written. This helps ensure that all Healthy Start sites ask the questions in a uniform manner. You'll notice instructions or notes for staff throughout the form. These notes typically say staff and are bracketed. This text should not be read out loud to the participant, but instead is meant to notify you of ways you should ask the question or things you should consider when asking the question. If the accompanying adult changes during the pregnancy, you will need to complete a new background information form with a new unique ID for the new accompanying adult. This will allow your program to record changes that may have an impact on the woman and her pregnancy.
Thank you for participating in the Healthy Start program. The purpose of these forms is to examine how well the Healthy Start program is meeting its goals of helping families improve their health and the health of their babies. This form should take about 10 minutes to complete. Any information you provide will be kept confidential. You do not have to answer any questions you do not want to, and you can end the interview at any time without any penalty or loss of benefits.
You'll notice there are several staff notes in this first section. Remember, the notes should not be read aloud to the participant. Instead, the interviewer should read the notes to him or herself and use them to help guide or inform how to ask the questions. Again, you might find it helpful to highlight these staff notes and familiarize yourself with them before administering the forms. For example, the staff note in question 1 reads, "If the woman does not yet know her due date, then this question must be completed when she does." This note lets you know that you should revisit this question once the woman knows her due date.
For this questionnaire, I'd like to start off by asking you a couple of questions about your pregnancy. First, what is your baby's due date?
October 20th, 2020.
How many weeks pregnant are you?
I'm going on 14 weeks.
The staff note in question 2 reads, "If the woman is not sure how many weeks pregnant she is, help her determine this based on her due date and today's date. If she does not yet know her due date, complete this question after she does." This note lets you know that you should pause and help the woman determine how many weeks pregnant she is, or mark this question to revisit once the woman knows her due date. The staff note in question 3 reads, "Based on how many weeks pregnant the woman is, what trimester is she currently in?" You should pause and determine which trimester the woman is in based on the definitions listed in the answer. For example, the first trimester spans weeks 0 to 13. The second trimester spans weeks 14 to 27, and the third trimester spans weeks 28 to 40. The staff note in question 4 reads, "When did the participant enroll in Healthy Start?" This question is asking which trimester the participant joined during. In this case, we know that Maria just enrolled in Healthy Start and that she is 14 weeks pregnant, so she is in her second trimester.
How many months pregnant were you when you had your first visit for prenatal care?
I was 8 weeks pregnant.
For question 5, you'll notice the participant's answer determines whether you ask subsequent questions or whether you skip to another question. For example, if Maria responds that she hasn't gone for prenatal care yet to question 5, Morgan should ask question 5A, which asks if Maria has an appointment scheduled yet. Be on the lookout for this type of sequencing throughout the form. The staff note in question 6 reads, "Please select the corresponding trimester for when the woman had her first prenatal visit." In this case, Maria had her first prenatal visit when she was 8 weeks pregnant, so she was in her first trimester.
Do you know if you are carrying multiple fetuses or not, i.e. twins, triplets, or more?
Just one.
If the participant responds to questions 5 through 6A that she has not yet had a prenatal visit and/or she does not yet know whether she is pregnant with multiples, mark questions 5 through 6A and plan to revisit them once the participant has had a prenatal visit. Question 7 asks about the participant's health history during the 3 months before they got pregnant. For question 7, make sure you read through each health condition and the possible answers for each. For example, no, yes, not sure, or decline to answer. You should enter one answer for each health condition.
During the 3 months before you got pregnant with this child, did you have any of the following health conditions? Type 1 or type 2 diabetes, not gestational diabetes or diabetes that starts during pregnancy? Yes, no, don't know, or you can decline to answer.
No.
High blood pressure or hypertension?
No.
Depression?
No.
Other chronic condition or illness?
No.
Okay.
Please note you should only ask question 8 if the participant has another child other than the one she is currently pregnant with.
Thinking about your child who was born just before the one you're now pregnant with, how old was he or she when you learned about this pregnancy? Was it 0 to 12 months, 13 to 18 months, 19 to 24 months, more than 2 years? This is my first pregnancy, don't know, or decline to answer.
0 to 12.
Okay, thank you.
The next several questions ask the participant to select one answer out of a list of possible answers. Be sure to read all of the answers to the participant before they select their final answer.
Next, we have a couple of questions about your home life and plans for the baby. What method do you plan to use to feed your new baby in the first few weeks? Select one only. Breastfeed only. Baby will not be given formula. Formula feed only. Both breast and formula feed. Don't know yet, or decline to answer.
My hope is to breastfeed only.
Would you describe your partner or the father of this baby as, and select only one, involved in my pregnancy and supportive of me and the child I'm carrying, involved with the child I'm carrying but not supportive of me, involved and supportive of me but not the child I'm carrying, not involved or supportive of either me or the child I'm carrying, not aware I am pregnant, decline to answer.
He's involved in my pregnancy and supportive of me and the baby.
Okay. I'd like to ask you some additional questions about your current use of tobacco and alcohol. How many cigarettes are you smoking now on an average day? A pack has 20 cigarettes. So 41 cigarettes or more, 21 to 40 cigarettes, 11 to 20 cigarettes, 6 to 10 cigarettes, 1 to 5 cigarettes, less than 1 cigarette. I didn't smoke then, don't know, or decline to answer.
I didn't smoke.
Question 12 screens for tobacco and nicotine product use. For question 12, make sure you read through each nicotine product type and the possible answers for each. For example, more than once a day, 2 to 6 days a week, 1 day a week or less, not at all, don't know, or decline to answer. You should enter one answer for each nicotine product type.
How often, on average, are you using other tobacco or nicotine products now? E-cigarettes, electronic cigarettes, and other electronic nicotine vaping products, such as vape pens, e-hookahs, hookah pens, e-cigars, e-pipes, are battery-powered devices that use nicotine liquid rather than tobacco leaves and produce vapor instead of smoke. A hookah is a water pipe used to smoke tobacco. It is not the same as an e-hookah or a hookah pen. E-cigarettes or other electronic nicotine products, more than once a day, 2 to 6 days a week, 1 day a week or less, not at all, don't know, or decline to answer.
Not at all.
Hookah, more than once a day, 2 to 6 days a week, 1 day a week or less, not at all, don't know, or decline to answer.
Not at all.
Chewing tobacco, snuff, snus, or dip, more than once a day, 2 to 6 days a week, 1 day a week or less, not at all, don't know, or decline to answer.
Not at all.
Cigars, cigarillos, or little filter cigars, more than once a day, 2 to 6 days a week, 1 day a week or less, not at all, don't know, or decline to answer.
Not at all.
Thank you. Since you found out you were pregnant, how often have you been drinking alcoholic beverages? Nearly every day, several times a week, several times a month, less than once a month, or never?
Never.
The mandatory prenatal form is complete.
Now that all of the questions have been answered, the prenatal form is complete. However, once the participant delivers her baby or the pregnancy otherwise ends, you must also complete the pregnancy follow-up section. We will now review the pregnancy follow-up section. Remember, it is important to record the pregnancy outcome for every woman who was in Healthy Start during her prenatal phase, even if she leaves the program. Do not read these questions to the woman. Instead, determine the outcome in a way that is sensitive to the woman's feelings and record them on this form. Your next steps will depend on the outcome of the pregnancy. If the pregnancy resulted in a healthy mother and baby, then you should complete the parent-child form and update the background information form with the participant. If the pregnancy outcome was mixed and included both a live baby and a fetal or neonatal death, or a very ill baby or mother, please practice sensitivity. You may want to consider delaying completion of the parent-child form for the live baby, or updating the mother's background information form until their next visit. If the pregnancy did not result in a live birth, for example, a miscarriage, ectopic or tubal pregnancy, fetal death or stillbirth, other pregnancy termination, or neonatal death, please practice sensitivity. You may want to consider delaying updating the background information form until the next visit. Now that all of these questions have been answered, the post-pregnancy follow-up section is complete. Thank you for taking the time to watch this demonstration of the Healthy Start prenatal form. We hope this guidance helps you successfully administer the form to Healthy Start participants. If you have any questions or comments, please email healthystart@nichq.org. That's healthystart@nichq.org.
All right, perfect. All right, thank you. So we see there are a lot of questions that are coming up in the form, and again, we're going to get to as many as we can, but we actually want you to take time to practice using the form, and we're going to ask you to either go on mute and step away and call your colleagues and work through the form with a colleague within your program, or you can sign out and then come back in, but take time to practice actually going through the form and see what questions are generated through that process, and you'll come back. And Olivia, what time are we asking folks to come back?
We would like everyone to reconvene at 3:50 Eastern Standard Time. So that's 2:50 Central Time and 12:50 Pacific Time.
All right, so take about 30 minutes just to practice going through the form and continue to chart your questions. And we'll look at the chat box during this time, and any that we can answer, we'll try to get some answers in the chat box as well. So again, take about 30 minutes and we'll see everyone back at 3:50. We're gonna start with some frequently asked questions and questions that you may have through your experience of practicing with the form. All right, good luck. So what I asked though, if you have a thought about the overall experience with the questionnaire, to be nice for your colleagues to hear how it went for you. So if you can chat in your overall experience with the form. Okay. Overall, much easier to use, easy to follow. Any other thoughts? So seeing easy a few times. And some folks have been practicing since March 30th, great. Okay, I like the form, it's more simple. Don't like question 11. I think we saw a lot of questions about question 11, so thank you for that. We have some responses to some of that as well. Simple, easy, and short. Okay. Declined to answer. I know that came up for folks. So I think again, and just from conferring with Robin, that when you're doing a common survey and research, you do not read decline to answer aloud, but because you want to give that person the option up front, so we understand the comment. But when we think of the kind of data collection that we're doing in the population that we're working with, it's probably good for clients to know up front that they have that choice. And so if others had that thought as well about reading aloud decline to answer option. Okay. So it looks like a lot of folks found it easy and simple, short, etc. Okay. Like the form more friendly and simple. So these are helpful. We know that you had lots of questions, but this feedback is also very important, as again, I know Robin and her team worked very hard on the forms, and so it's again a challenge going from 5 to 3. So your feedback is quite helpful. So thank you for that. As we look in this at the form itself, so the prenatal form, just some frequently asked questions that Robin was able to get to before today's training. So I want to go through those. And one was, how should the form be dated? Since there are 2 sections, and referring to this and the post-pregnancy section, and the form is subject to update. So if you look at the beginning of the form, numbers 3, 4, and 5, there you will see the dates are pretty specific. So you have the date of enrollment in the Healthy Start. You have initial completion of the form. So that's pretty straightforward. And so those are the dates there. And of course, when you do the post-pregnancy follow-up, that date is entered in, that you're completing that form. So that was the answer to that. All right, next slide. Okay. Another frequently asked question about the form was, within that time frame, should the post-pregnancy follow-up section be completed after at least 27 days? And I know we had lots of questions on that. Robin, can I turn to you to answer a few of those questions that we already answered, that you already answered in the frequently asked questions? Because we had quite a few questions on that. So any you want to list?
Sure. This one here about the time frame.
Mm-hmm.
Basically, in most situations with an uncomplicated birth, a healthy baby, a simple end to the pregnancy, if such a thing is ever simple, but a very straightforward, uncomplicated situation, then we would expect you to be able to report on this within a week. But in a very complicated situation, such as is described here, with an infant in the NICU and a tragic outcome and everything, we would say maybe a month seems very reasonable.
Mhm. Olivia, are there any some other questions related to the post-pregnancy form that we can ask that Robert can answer?
Oh, right.
Sure. That were asked in the chat box.
Yeah, 'cause some of
Yes.
them already answered. Huh?
We did receive a number of them. So we already answered one. So when you go to do this follow-up section, you only answer the 5 questions in this section. You don't need to go back and redo the entire prenatal form.
Okay.
Yes.
How do we know the outcome if the woman is lost to follow-up or leaves voluntarily?
Right. I mean, obviously some attrition will occur, and there is an option in the form. It says outcome unknown, so that is a response option. We do have the methods because if a staff member comes later and says, well, did we find out what happened with this person? You want them to be able to look back and say, oh yes, I see that, you know, we did this, we contacted the family, we looked at, you know, birth records, you know, we did all these things, but we weren't able to find anything. So yeah, I can see that this is done. We don't know the answer.
Thank you. And I think that relates to another question that was asked. Someone asked what the question that says describe methods used to track neonatal death or describe methods used to track maternal mortality. Those are options under several of the questions in the follow-up section. So just to clarify, they should describe what methods they used to
Right.
try to find out that information if
Right.
they weren't able to find the information.
Exactly. And that's exactly why you tell us what methods you use to track the information, is because we know that sometimes it will be difficult to find that out. And so that's to be a record of, you know, what you did to find out. So
Great.
I think go ahead, Olivia, with.
Okay. Let's see. So there's a question number 5 in the follow-up section asks what the information source is.
Right.
And someone asked, what information should we be considering? Is this all post-pregnancy data or just maternal mortality data?
Yeah. Yes, it is all the questions. It really is check all the things that you've used to answer all these questions. And it could be just very straightforward, you know, we found out everything from the client. But in some situations, it's going to be much more complicated.
Okay. And just to clarify, I see there was a question, where am I reading the question about tracking methods? So under question 3 in the follow-up section, one of the options is indicate how many neonatal deaths from this pregnancy. And if you go a bit further down, it says describe methods used to track neonatal death. And again, in the next question, number 4, again, that's an option, describe methods used to track maternal mortality. Ken, do you want to move forward or should we keep?
Yeah, I think we got most of those questions underneath the post-pregnancy form. So if there's any others, you all feel free to chat the question in again. But again, we have many of those questions that will be part of the Q&A document that Robin's already answered. So you'll have that in front of you at some point. All right, next slide. Another frequently asked question. The next slide. Okay. Or on question 1, we'll ask about the baby's due date. Does this only relate to the due date at intake if the due date changes, should it be updated? And Robin, we're saying no, it does not need to be updated because you will have the birth outcome date that you'll use when you complete the parent-child form. Is that correct?
Yes.
All right. Okay. And we also don't have an idea of how often that might happen either. So that may be something you as a local program want to keep an eye on. But for right now, to be clear, the date does not need to be updated. Okay. All right, good. Next slide. Okay, so question number 5, if any of you had questions about number 5, it asks that the woman, if the woman has had her first prenatal visit, does this include any prenatal visit or a prenatal visit at her organization? And that includes any prenatal visit, correct, Robin?
Yes, it can be anywhere. There was another question about, well, what if it's just a visit for lab work or something? And I guess that depends on what the lab work was. I mean, if it was just a pregnancy test, then it would not be counted as a prenatal care visit. But if it's if it's already, the pregnancy is already established and they're seeing a nurse just to have their history taken, or some other type of lab work in preparation to see the OBGYN or some other doctor, then that would count, I think, because it's preparatory.
Thank you. All right, next slide. Okay, question 10. And we saw a few questions related to question 10, but it asks if the woman has a supportive partner. So how do we respond if they have a partner who is supportive but unable to be involved? For example, they're incarcerated, or they have a partner who passed recently and was supportive of this pregnancy. So we realize this is a difficult question, but Robin, how do we want to respond to this today?
Yeah, I think we'll allow another option, and that's something that, you know, we're going to put on our list of updates and to think about for the future, so that if there is no situation, if your situation doesn't apply here, then you can make a note that, you know, it's other, and then just specify what it is.
Yeah. And as this is an opportunity to ask about that partner or the father, I know that we'll be working with the division on really coming up with the questions that can be asked, even as outside of the data collection form, but certainly as a part of this question, to think about subsequent questions that really get at his involvement and support, because support and involvement can be looked at a little bit differently. So we'll explore that and make recommendations as we work with many of you and your father coordinators, but really looking at, is the father partner supportive? Because there are different ways that people interpret support. And again, I think as we think about engaging fathers in this work, a father could be dropping her off at her appointment. He could be giving her tokens to take the bus to get to her appointment, not knowing that he can actually come to the appointment. So it really looks different how people interpret what supportive and what being involved is. So again, these are things that we need to explore as we really shape fatherhood within this maternal child health framework and within Healthy Start. And I'm sure that we're going to be able to add a lot to this as we move forward as a overall program to really speak to the field on how to really include fathers in prenatal care and prenatal visits, because there's lots of work to do there. So this question is a challenging one, but I'm certain we're going to spend a lot of time working on it and other methods and how to really capture the data that we need to tell the true story of the fathers and partners of these women. So stay tuned for that is what we'll say. And those of you out there that are coordinators and program managers and project directors, this is certainly an opportunity for us to look at how do we then really shift into getting the kind of engagement that we're looking for with partners and male and fathers. So, okay, all right, next slide. So another frequently asked question here was question 11, as we heard in the chat box, or see in the chat box, lots of questions around question 11, Robin. So we kind of anticipated that. So And again, as Robin said last time and for this time, we're taking notes on all the questions and really taking your feedback to really build this document. So when it comes at a point where we do update the forms, and we'll have all of this information there, but your suggestions and comments are really important. So Robin, how will we answer this one today?
Right. Well, we talked about the update for I didn't smoke then, that it means I don't smoke now. This question is drawn directly from a standardized survey. It was very important for us to not fiddle too much with questions that were part of standardized surveys because of the need to have comparable data. And so this is like word for word, including the I didn't smoke then, because it's a survey that's administered to postpartum women nationally. And so that's why it says I didn't smoke then, because it's talking about their pregnancy. But we're using it in a different context. So it should say I don't smoke. But I'm sorry that it's not a friendly question. It says that's going to confuse participants. No other options can be added. I'm not, what is, yeah, I don't understand.
Yeah, I think if people don't hear the option, I don't smoke, but they hear I didn't smoke then, and you're asking them about now, maybe that's what they mean.
I see.
Yeah.
Yeah, no, you're not going to read. I think that there's an art to doing this kind of data collection that I would not read everything for all the response options verbatim. I think sometimes people give you the answer right away. I would just take that. This is not a research survey. It's a data collection form, and you have a relationship with that person sitting in front of you, and you need to do what you can to foster that. And so, you know, if you're laboriously reading something, then, and she's going to feel it, and she's not going to be real happy either. Neither of you are going to be happy. So I guess I would say, how many cigarettes are you smoking now on an average day? A pack has 20 cigarettes. And she says, oh, you know, I guess I smoke about a pack and a half. Well, I guess a pack and a half is about 30 cigarettes. I mean, if I'm counting correctly, you know, because do people really keep track of the number of cigarettes they smoke a day? I don't know that very much. But
I guess that's good, right? I guess we could say then that HRSA will provide guidance on this one a little bit later, but for right now, I think your explanation is helpful. Again, we know that I didn't smoke then wasn't the right one we wanted, but for right now, we'll just stay tuned to hear what HRSA says as a final on that. And I would be interested, we have Alicia Shaw, who made a comment that most clients will let you know right away if they don't smoke. And I would just like to ask the attendees today just to chat in the chat box, what do you think about that statement that Alicia Shaw made, that most people kind of come out and tell you if they don't smoke? Just curious about that as well, okay? But again, HRSA will provide more guidance on this particular question, as we had lots and lots of questions around it. All right, next slide.
Ken, can I also ask a clarifying question? So we said both in the video and the beginning of the form says to read everything in italics verbatim. So that's the question itself. But that means that the answers don't have to be read verbatim because they are not in italics, right?
Correct. Right, Robin?
Yeah, I would say that when you're asking a factual question, and they give you a factual answer, then it's probably, you can probably find the answer among the options. If you're asking a more complicated question, like the one about is your spouse or partner supportive, there you had very specific options. And so there you would want to read them aloud, just because they're not something that people would naturally come up with as an answer. unless you provide them the wording. But for a lot of the questions, you know, like, do you smoke cigarettes, or, you know, have you used this kind of drug, or, you know, the whole substance use thing that the Boston Healthy Start interviewer read, you know, going through every single item, that's probably not really necessary in this type of interview. It's, you know, if the person doesn't use drugs and they tell you, there's no need to continue to read a long list of drugs.
Okay. Thank
Within
you.
a certain category, you know, because they have a long list like Quaaludes and this and that and opiates, and it's just like 5, 6, 7, 8 different things just for one category of drug. Most
All right.
people get the idea.
Yeah, so as we
Thank you.
said, HRSA would definitely provide more guidance, but I want to just acknowledge everyone's reply, because that information is also helpful to consider as we come back to this. So thank you for taking time to give us your thoughts around the smoking question. Let's look at the next slide. Oh, so now more questions. So we can continue on with questions. So we have a few minutes. So any other questions, Olivia, want to lift up as you see in the chat box?
Yes.
Or
One-
Robin, if any you want to highlight as well too. So go ahead, Olivia.
So one of the questions was, is the parent-child form completed as soon as the mom gives birth or when this baby turns 6 months old? So this was related to the end of the pregnancy follow-up section. Indicates that if there was a healthy baby that resulted from the pregnancy, then the parent-child form should be completed. So what is the time frame for that?
Right, you want to do it as soon as possible after delivery, because, you know, the woman is in the postpartum period then, and so you do it at that time. And then when the infant turns 6 months, you would do it, you would update it, essentially, the parent-child form. But that's the parent-child form. This is the prenatal form that we're talking about today.
Right. There was just the point at the end of the pregnancy follow-up section about
Yeah.
what to do next.
Oh yeah, that's just simply guidance on, you know, this is the forms you would fill out in this situation. It was just meant to be guidance.
Mhm.
Yeah.
Okay, thanks.
There were, sorry, Ken, go ahead.
No, I was going to say, because I saw a quick question, just wondering, asking why wasn't why there were no questions on marijuana? Is there any feedback on that, Robin, just from the earlier process?
Well, there is in the background information form, there's a question on substances used, and marijuana is one of them. A question was asked about medical marijuana, and the way the whole survey, the way that whole question is written has to do with sort of the non-medical use of things. So it was non-medical marijuana.
Gotcha. Okay. All right. Go ahead, Olivia. Sorry.
Next, we had, has HRSA expanded the well women postpartum visit to 12 weeks?
This is actually guidance from the OBGYN national group. It's called ACOG. They have issued guidance that the postpartum period should be considered 12 weeks long. And so, you know, recognizing that you have several different reporting requirements that concern that 12-week period of time, we've tried to give different options that will cover those various reporting requirements. So it's not HRSA that's changing its definition, it's the entire OBGYN world is changing its definition.
Okay, thank you. Let's see. There were a lot of questions about the unique ID number. I'm wondering if we could go back to the slide that showed the format for that.
Sure.
The next one, Tess.
Yep.
Yep. So if people wanted to clarify what the format should be. So the numbers in green are the grantee org code, which has been assigned to you by HRSA. PP will stay this, that just represents primary participant. If you're making a unique ID for the accompanying adult, that would be AA. And then the unique ID is a 4-digit number that your team would create. Is that correct, Robin?
Yes.
Mhm.
Well, it would be preferable if it went sequentially, beginning at, 1 and going upwards. We had so much variation in how the IDs were created last time. It was actually difficult. It made it kind of difficult to pull it all together. And so it's good to have sort of a standardized system across grantees. And so that's why we're asking. I know some of you have your own systems and your own case numbers that you assign to clients. And, I'm wondering if software maybe has the capacity to link that. So it would link your case number with the ID for this so that things would be clear that way.
Okay, and someone asked, isn't this ID created when you do the background information form?
Yes,
and
it
I
is.
believe that's correct. Yep, and the
Yep,
same
and-
ID
and-
number.
It's the same ID, right, exactly. Yep.
So that number should be written down on every form that's completed.
Yes. Yes, because we have to link it all back to the same individual, to the same set of data. Right.
Yeah, and I see some questions related, Olivia and Robin. So one with regards to the grantee org code. So again, they were issued to you by HRSA, but if you do not know your grantee org code, just send us an email here at the TA Center and we will help connect you with that number. But everyone has a grantee org code that you were given. Okay, so we can help you with that. Also, a lot of questions with regards to just the 4-digit number, Robin. And so folks are asking if they can go to 5. Patricia, shout out to you because she asked what happens if you go over 1,000 primary participants. First of all, we want to award her. That's awesome to have 1,000 participants. But again, I think Robin, in our earlier conversation, is you shared the experience of really doing aggregate data, and for the purposes of the division, when we're pulling this data together for larger reports, it's important to have that standardization. So again, imagine 101 sites having their grant organization code plus pregnant participant and those numbers. It's easier to then to pull that data together. So any variation on that will kind of skew things and make it more difficult. So again, we're asking folks to stick to the 4 digits at this time.
Right, and just to say again, that the unique ID has 3 parts, and the first part is the org code. The second part is the indication of, AA, PP, or EC. And then the third part is the number that refers to an individual client. And you would start with, 0001 and then go up sequentially. So we're not saying just go make up, a 4-digit number. No, the unique ID does not go back to 0 because it's sequential over time and people have to keep the same ID over time. And no, you do not have to update the prenatal form for screenings done in 2019. Well, and you would only use Healthy Start clients for this particular database. Yeah. Yeah.
Yeah,
Okay.
so this is good feedback, you all. We'll keep it
Yeah,
all.
no, these are great questions. Yeah.
To consider these things, we certainly have the option of coming back to you, but just for now, we're giving it as is for today. But we can certainly revisit. All right, another question that you saw out there, Olivia?
Is the prenatal form supposed to be done in the same visit as the background form, or does it not matter?
I think that the sort of standard is 3 visits, that within 3 visits of enrollment, you will have completed all the relevant forms that you need to complete.
And will there be a data dictionary and an XML schema released?
Yes, I think that's going to happen later in the year as the HSMED2 and the Careware get up to speed.
Okay.
If people are asking, I see questions with regards to how to capture the data before the Careware database system is ready. I think we went over this last time, but we'll reiterate again that it's basically hard copy until the database is ready.
And it is correct that you would never have an accompanying adult prenatal form. It would always be the enrolled pregnant woman, right?
Mhm.
And just to clarify, if you do have questions about your unique ID number, you can go ahead and email healthystart@nichq.org, and I'll write that email address into the chat box.
Yeah, and I think a Careware demonstration is planned for the grantee meeting in June. And Careware, it has a module for case management and a module for this evaluation and this data collection. And those two can speak to each other. So, but these are all, you know, great questions.
Yeah. Any other question? You see, and I see a couple of sorry, I mean, Olivia, just real quick, but those, I see a couple of questions related to Careware. And those of you that are using systems now and you're interested and open to looking at Careware, and you have some thoughts or suggestions or questions about its capabilities, feel free to put those questions in so we can consider those as we are building the data system. So things that you would want, because a couple of those questions kind of refer to that. Can Careware do this or that? So if you have questions like that, and shout out to Mary Cronin, thank you for kicking that off. But if you have thoughts and questions about what Careware will be able to do, feel free to put those suggestions in so we can take that back to the team that's actually working on developing the system, things that you would need. Because we can't answer those today, but certainly we want those thoughts and suggestions, so thank you. All right, Olivia, sorry about that.
There was a question, what if the primary participant is a male? So they would not complete a prenatal form, but
Well, yeah.
Go ahead, Robin.
Yeah, thanks. The male primary participant would be the custodial parent of an enrolled child. So he would be completing the parent-child form and the background form. He would not be pregnant, so he would not complete a prenatal form. He already has a child. That's why he's there. He's there with the enrolled child.
Thank you.
I hope that.
Peggy asked, if it will take 3 visits to complete all the forms, does that mean a client will not be considered enrolled until all the forms are done?
I don't think so, but some of these program is gonna, the program here is gonna have to discuss and consider to give final answers. But no, I don't think that you have to wait 3 visits before considering her enrolled. Right.
Okay.
And Olivia, I'm gonna jump ahead of you because I see another important question. Jessica asked, will grantees be required to enter data into Careware? And again, Careware is not mandated that you use the Careware system. We do acknowledge that some folks are using other systems already, but just note that this data, or whatever system you use, that data will have to be extracted and uploaded in HSMED, the federal database. And so more about that later, but that's scheduled for the fall. So just be aware of that. So again, you're not required to enter data into the Careware because they're not mandating that system. But just know that you will have to upload data into the HSMED. All right. Sorry, Olivia, go ahead.
I think we have time for probably one more question. We have about 5 minutes left.
All right.
Ken, do you see any that you want to address?
No, that was one I thought was important to lift up.
Okay. So just to clarify, with current program participants, do we rescreen once their category changes? For example, a new pregnancy, or do we rescreen automatically at the next visit after we begin using the new forms?
Hmm.
I'm trying to find it in the chat.
This was from Shannon Williams.
Uh,
So while Robin is looking, just advance the slides and so we can get to the next piece so we can honor people's time as well while she's looking at the FAQ document.
So I guess just to
Oh.
rephrase this question,
oh, here we
since
are.
we
yeah.
have new forms, does everyone need to be rescreened with the new forms, or do we just wait?
No,
Okay.
no. People, you wait until their next visit and then you give them whatever forms are appropriate. Remember, everyone gets the background information form. Everybody has that, every adult. People with children also do the parent-child form, and pregnant women also do the prenatal form.
Okay. All right.
Great.
If you
So Tess, if we could advance to the closing slides.
Yeah, and while we're getting there, just to reiterate again, all of the Q&A, the questions will be available on the Q&A document that we're preparing for you, and you'll have that as soon as it is complete. So you have it ahead of time. Again, you're required to start using the forms on May 15th. And so certainly you'll have that document. And thanks to you all and the way you submitted your questions, we've kept them categorized on each form. So you'll be able to look at questions related to the particular form. And then answers associated with those questions. So that's coming up and it will be available. Again, just as a reminder, you will have access to this presentation and the demo post this webinar as well, but the one from last week is already available for you. So we're looking forward to the next training. So next slide. About 2 minutes, I have to talk quickly. Next slide. So again, the next training is Thursday. From 12:30 to 2. So we look forward to seeing you there. And that's on the parent-child form. Next slide. Again, we will, as a center, continue to provide support to you. Again, we're going to use this document to just strengthen and our implementation of these forms and just be the ongoing support to you. We appreciate Robin, again, and her leadership and those at the division that help get these forms ready for implementation. And again, we look forward to providing ongoing support and training around these forms. We're looking at and talking about office hours. So for those of you that actually want to go through different sections, we want to really make ourselves available to do that. So whatever your need is, we want to make sure we meet that need. So again, expect us to support you in any way that we can. Next slide. So at this time, it is 4:29. So before you leave, we want to remind you that we do have a survey that's really important for us to get information on how to make these trainings better. So please take just 5 minutes to complete the short survey. The link will be sent to everyone who registered for the webinar, or you can visit the address that's in front of you. But a survey will be sent to everyone who registered for the webinar today. Your feedback is really important for us. So please take just 5 minutes to complete that. On behalf of the division, Lee Wilson, Benita and staff, Vanessa and Robin, and the staff here at TA Center, we thank you for taking time this afternoon to do our second training on the data collection forms, and we're looking forward to Thursday. So keep practicing in the meantime. If you have any other questions, just send them along. And again, there are a lot of questions, and so we want to make sure that we answer those so that everyone's comfortable as we continue to do the best we can on the families that we serve around the country. So have a great afternoon and continue to take care of yourselves. Thanks.